Hello everyone, this is Swaraj Paul. Today we are talking to Dr. Nikhilesh Das, Senior Orthopaedic Consultant at Peerless Hospital, Kolkata. And today we are talking about the benefits of using visco supplements.
Knee pain or osteoarthritic knee pain is one of the commonest problems that every orthopedic surgeon sees in his practice. As we know, knee pain is very common among females after 45 and males after 55 years of age. So what are the causes of knee pain? And the most common probably cause is osteoarthritis. So basically, what is osteoarthritis? You see, the knee consists of a layer of cartilage which acts as a bearing surface where the joint moves. But gradually what you see, it starts to wear off. And the parts of the cartilage start to wear off, and this is what is called osteoarthritis. So this is grade 1 osteoarthritis. In grade 2 or grade 3 osteoarthritis, what happens is the entire cartilage wears off and the bone gets exposed. Then it becomes very painful for the patient, and it causes disturbance of sleep, difficulty in walking, difficulty in climbing stairs, doing activities of daily living, and also it happens that the patient is very uncomfortable. Somehow the mindset of the people is that once you have knee pain, the only probable solution is a knee replacement. But it's not true. Out of 100 patients I see, only 1 or 2 need a knee replacement. The rest of them are managed conservatively with various means ranging from physiotherapy to certain drugs or medications, physical habit modifications, weight loss, and certain minimally invasive things like visco supplementation or intra-articular injection of hyaluronic acid. It has been shown that once the people start to develop arthritis, with age the cartilage starts to wear off and the pain starts to increase, and the quality of synovial fluid that is inside our knee joint, the quality and the quantity both diminish. So what are the treatment options that we have? Initially we try with physical therapy. Once physical therapy is seen to give some benefit, we suggest for weight loss, because obesity is the only controllable risk factor of osteoarthritis. And once some amount of weight loss is done, it seems to help the pain relief of the patient. The next option comes is certain over-the-counter drugs or medications which help in pain relief. There are certain dietary supplements such as glucosamine, chondroitin, collagen peptides, all these things which varied results, but we do not have any proven results till yet. The next thing that comes into picture is the intra-articular injections or injections inside the joint. There are 2 types of injections that can be given. One is a steroid, which is basically a pain relieving agent, but it does not cause much of help in the pathology of the disease. The other thing is visco supplementation. The aim of giving visco supplementation is to provide the knee joint with fresh amount of synovial fluid in the form of hyaluronic acid. This new synovial fluid is in the form of an injection, and it is given inside the joint under a local anesthesia under aseptic condition, so that we do not insert any infection into the joint. And this helps in lubrication, number 1. Number 2, helps to reduce the inflammatory mediators, thereby reducing the pain and swelling and inflammation. And it helps in regeneration of certain cartilage cells, which help in providing relief to the patient. So what happens is this not only helps in lubrication, but also helps in reducing the chemical mediators and helps in regenerating certain cartilage cells. In these ways, the arthritic pain is reduced and patient is more comfortable. But it has to be used only in the correct indications, such as grade 1 to grade 3 osteoarthritis. no point in using viscosupplementation once the joint space is completely gone, because it would not work then. So when the cartilage is still there, it's a grade 2 or grade 3 OA, patient is not benefiting from oral medications and physical habit modifications, then we would give a viscosupplementation in the form of an injection. It can also be given after ACL reconstruction, because these patients do have some kind of cartilage injuries which happens during the ACL injury. And at times we also give it to patients with small osteochondral defects, patients with chondromalacia patellate, or in patients who are going for TKR of one side and the other side is minimally involved, we give in a viscosupplementation. And this has got very promising results. As you know, any person who has a knee pain and somebody advises him or her a surgery, he would probably try anything from acupressure to Ayurvedic to homeopathic, anything. And all those things do not have a proven result. Nowadays we have got results which are proven in literature that viscosupplementation works well, and I think it is a very good option in case of management of early osteoarthritis of the knees. In worst case scenario, say 1 out of 100 or 2 out of 100, where nothing works and the osteoarthritis proceeds to a grade 4 disease, where it is causing a restriction of activities of daily living, pain, the patient is having to take regular painkillers, then what we have to do is we go for a knee replacement surgery. But probably that is the last resort. It's not the only resort for knee pain. So I think the patient should be coming to the doctor at the early stages so they can avoid surgical intervention. Thank you very much.